Clinical and forensic psychologist, Dr. Daniel Bober.
Now for the top story tonight reaction. Joining us from Miami, Dr. Daniel Bober.
Clinical and forensic psychiatrist, Dr. Daniel Bober.
We have psychiatrist Dr. Daniel Bober.
Here to weigh in on the day's top story, Dr. Daniel Bober, founder of the Psychiatric Consultants of Florida.
Joining our panel is Dr. Daniel Bober. He's a clinical forensic psychiatrist down in Miami. Dan, great to see you.
Bill, I really couldn't disagree more. I think that we're sending them the wrong message to tell them that they're special. I think we need to be much more realistic. And we're kind of living right now in this eggshell generation. And unlike Humpty Dumpty, we have to teach our kids that they're going to have to learn to put themselves back together again. There are just some individuals who are deranged and who have sick delusional fantasies, and they live in their own world. And there's really there's nothing that we can do really as a society from a policy standpoint to prevent that from happening. I think there's been a lot of changes in our culture. For example, there's been changes in the traditional family unit. I think we are living in a social media cocoon, and although in some way it's easier to communicate, I think in some ways we feel much more distant and much more cut off. So I think that's something as a society we have to look at. When this type of tragedy occurs, people respond very differently to it depending on their genetics and depending on their family background. But for the first month or two, you may see people who don't express any emotion about it, and it's sort of the mind's way of protecting itself from such a shocking tragedy. The school is spending as much time with them, if not more, than their parents are. The school has to take some responsibility in this, too.
Clinical and forensic psychiatrist, Dr. Daniel Bober.
I think it was a tactical mistake not for him to take the stand because, you know, this is not a monster. This is not a habitual criminal. This is basically a teenage kid. Yes, there is a phenomenon that's called survivor guilt, and there are people who, for whatever reason, start to look at their life in a very philosophical way. Everyone is looking for something to lighten the burden of existence. They're looking to get away from everyday life, whether it's them having marital problems or problems at work. They just want an escape. Competency is not a static process. Someone who is deemed to be competent can be incompetent after a very short period of time. I think the fact that he's been treated is what's important here, and that he understands the charges against him and that he's able to work with his attorney.
Linda got help from psychiatrist Dr. Daniel Bober.
Sometimes people are afraid to seek help because they feel that they're going to be stigmatized or judged in some way. But now we're looking at something much more subtle, and what it's called is at-risk drinking. In women, even one glass of wine increases the risk of breast cancer 10%. To be using the term messing around indicates to me that he doesn't really appreciate or respect the seriousness of handling a firearm. Through his own negligence, he left out many steps in the process that may have avoided this tragedy. The name bath salts is a name that the street chemists are giving it to skirt the law, to fly below the radar of law enforcement.
Are those some of the signs that parents can look out for?
Absolutely. It's one of the few mental health disorders that medication is really the most effective.
Okay.
I always try to make medication the last resort when it comes to children because I think they should try to do it with therapy first.
If parents suspect that their child is being bullied or is the bullier, what can they do?
They can call the school and speak to the counselors. They can limit their internet time. The most common form of cyberbullying is instant messaging, and approximately 30% of school-age children who are on the internet have been bullied at some point. That is the part of the brain that says, wait, stop, I need to think about this before I do it. I need to put the brakes on.
A medic in the Navy, he witnessed tragedy we only hear about.
The front of my head hurt so much that I would pass out for a few seconds.
And is currently in treatment with Dr. Dan Bober out of Hollywood.
Service members have very unique needs because of things that they're exposed to in the battlefield.
Service members' suicides are now tracked by the military. There have been 1,100 deaths since the wars in Iraq and Afghanistan began.
I think the only person she's interested in saving is herself. I don't think she had any remorse. Basically, she's been caught and she knows it, and I think she's under extreme anxiety because of it. And I think she's doing the best she can to try to put on a good face. I've had multiple people tell me that they've had problems obtaining the medication.
Dr. Bober says people are being forced to go from pharmacy to pharmacy until they can find the drug somewhere.
We have psychiatrist Dr. Daniel Bober here to explain why this happens.
we are creatures of habit.
Yes.
We engage in patterns of behavior, and we stick to those patterns of behavior because we find comfort in the structure. Realizing that, I'm the one that's responsible for this situation, so I have to take ownership of it, and the only way it's going to change is through me.
She brought him to psychiatrist Dr. Daniel Bober and learned the foods her son was eating could be making his condition worse.
We know that certain chemicals that are synthetic, whether they're dyes or in the environment, can sometimes cause behavioral symptoms.
Dr. Bober says of the millions of people with ADHD, up to 30% of them may be affected by food coloring. So, the advice for parents?
I'm telling my patients that they should be aware, and before they put their kids on drugs, that they may want to consider a restriction diet.
I think it's improved my life, which I wouldn't have done without my doctor.
Dr. Daniel Bober, so valuable for your input today. Fascinating information. Thank you.